executive order, we're suspending certain provisions of the open meeting law. We are conducting this meeting online, and to ensure public access to the discussions of the Boston Human Rights Commission, the public may access this call through telephone and video conferencing. Members of the public will have an opportunity to make comments at the end. This meeting is being recorded. The first thing on our agenda is the approval of September 30th meeting minutes. Are there any additions or corrections, omissions? Could I have a motion to approve the minutes?
I so move.
Second?
Second.
All those in favor? All those opposed?
Aye.
Minutes are accepted. And
Can I add that the minutes are wonderfully done?
thank you to Susan.
Yes, yes.
Thank you very much.
Thank you, Susan. Very well done.
Thank you.
Kudos, Susan.
Oftentimes they are not, but she's done a great job. So the next thing on the agenda is a brief report between the executive director and me. And Evandro, do you want to go first in terms of catching up the rest of the commissioners on some of the things we've done as follow up to the last meeting, and then we'll move to the central meeting agenda item with Michael Lynch.
Of course. Thank you, Madam Chair. I'm Evandro Carvalho. I am the executive director of the commission. Good afternoon, commissioners. Welcome back. I'll be brief. I did want to update, obviously, the conversation that we're going to have today, particularly about the divide, the digital divide that we all been talking about for so much. I think it's going to take a step forward, having Mike Lynch here as the director of cable and broadband in the city to kind of update us on what the city is doing. Mike, welcome. I actually viewed the city council hearing that you were part of in preparation for this. And I'm excited to have you here for us to hopefully come up with some strategies about how the Human Rights Commission can help this mission that we all undertaken. I guess the other thing that's on the agenda is the International Human Rights Day, which is December 10th. Hopefully we have a robust discussion about what that may look like. On the more operational side, we've been in a meeting since last time. We talked about potentially some hires that we need to adequately build the capacity of the commission. We've talked to budget about it. We continue conversations with them. Some conversations obviously with the chair, McKenna. We're narrowing down at least 3 positions that hopefully in the next, very soon, I should say, we will be rolling out to build capacity so we can do the work that we want to do long term. I think that's all I had for now. But I'm excited for the discussion, and hopefully we can keep the momentum.
Okay. So let me update a few follow-ups as well. If you remember, we talked about the police, the task force report on the police. And Evandro and I are meeting with the head of that task force, Wayne Budd, in fact, tomorrow, and to see what he believes, how we could be helpful. I want to make sure everyone here, and we should send out, Susan, the URL to people so they have a copy of the task force report. And I would like, if we could, here, Susan, is to make sure we have a 1 or 2 page document which lists the recommendations of the report and any timeline of that report that exists. I'm not sure there is a timeline, but certainly highlight in 1 or 2 pages the recommendations, and if there is any timeline recommended. Okay. As we said last time, and I think there was pretty much agreement that I thought our role should be to represent the public, that this task force report not be put on a shelf, and that whether or not we were responsible for the recommendations, that I thought our responsibility was to make sure to be the conscious of the public, and that we report quarterly on what was the status of these recommendations. So I think all the commissioners ought to make sure they have a copy of the report and that we have a copy, we highlight the recommendations in a timeline that exists. And we will meet with Mr. Budd tomorrow. The other thing is, I know one of the things been talked about a lot is, and I'm not sure, I don't think it's in the recommendation, is the role of police in the schools. And Evandra, maybe you could find out where that stands at the moment. I know that the superintendent has a new policy in terms of the role of police in the schools. And I know she has changed the policy in terms of reporting, in terms of the police that are in the schools and sharing information with others outside, even in the police department and certainly with other entities in terms of policing. If we could find out what the policy, has the policy been adopted and what is it?
Okay.
It fits in with one of the things we've talked about in terms of immigration and the role ICE is playing in our city. I think we talked about the last time that we were concerned about what we had seen about ICE stopping somebody on Jamaica Plain who was running and what they were doing in the city, you know, picking people up. And I think one of the things that, Evandra, you brought up to me is, and we can talk about either later today or at another meeting, is when things like that, should we as a commission, what is our role? Should we speak out, make a statement, and how should we do that? And at some point we should figure that out. I mean, I could do it as the chair, Evandra could do it, but I really think it, certainly the first time the commission needs to, as a whole, say, yes, we want to do that. So the next time something like that happens, I think we should send something to you, have you approve it and say, yes, we should do that. The Human Rights Commission, if we are going to do something, at least the first time, we should get your authority to do that. So.
Before you move on, there's a new head of the school police also.
Yes, there is. And I've met her actually. But I'm really curious. And I know she has been active in this. But the policy, I don't think has been public yet. And I know what it is. And there was some discussion about tinkering with it, but I don't know where it ended up, to be honest. So, so that was my update. And the last update was the COVID task force, health task force, which has not submitted its report yet. But Evandro and I are setting up a meeting to meet with Marty Martinez, Chief Martinez, sometime in the next week or two as well, to see where we might fit in or be helpful to him. So any questions other than that from the last meeting or follow up? Yeah, Ben.
Two things. One is both about the task force report. I have read through it. I've not read every word. The recommendations are sort of tiered. So there's like, you know, a higher level recommendation, and then there are like maybe 5, 10, whatever sub recommendations under each of that. So for Susan, are you asking her to summarize the high level ones and sort of skip the sub recommendations, or do you want something that covers everything?
Ben, what do you think would be most helpful?
Well, I think part of it depends on what Mr. Budd tells you tomorrow. I heard that the task force is not going away, that they are actually sticking around and doing something along the lines of this monitoring and timelines. If they are, then I think the high level ones are more useful to us. If they aren't, then there really is a void that someone should step into. But I think that I would really want to hear from him so that there's not, you know, duplicative or dueling sort of reporting structures.
Right. Why don't we find that out tomorrow? I didn't realize that. In fact, I thought the opposite, that they were going to disband. but, and the staff person was going to stay involved, but the others were not. Let's find out. Let's find out. I think that's a good point. then.
You'll get the truth.
We don't have to
I'm
guess.
telling
We
you
can
rumors.
ask, right? We don't have to guess. We can ask tomorrow.
Yeah.
Okay, good point, though. Okay, anything else that we forgot from last time? Okay, so.
Madam Chair, before we go into dive hopefully into the discussion of with Mike Lynch, I see that Chief Crockett joined us. I want to thank her for leadership on this issue. She's is very eager and has been very helpful trying to get the city thinking about some of the same things that we're talking about here. So, I welcome her input in terms of what we can do as a commission to help the city to close this gap. Just wanted to give her a shout because I know that she cares about this issue very much.
Yes, absolutely. And Chief Crockett, do you want to say something now? You want to wait until after Michael does his presentation? Mike Lynch does his presentation, totally up to you. You're the chief.
Can you hear me?
Yes.
Yes. Okay, great. I like being in this kind of virtual space with you. I just want to say hello. I'm just here to support, to listen. Happy for the conversation. And let's see. Let me see you for a second. Can you see me? Okay, great.
Yeah.
So just happy to be here. I was texting, I was sending a message in the chat to just say, sending greetings to the commissioners and Chair McKenna. Looking forward to the conversation. You got a big ally here. I'm delighted that you all are thinking about how to support the Health and Equities Task Force work. I sit on the task force as well, so can weigh in on that. The police reform task force. We got multiple task forces going, so happy to revisit and talk about any of this work with you since I've also been engaged in those discussions. But the digital equity discussion is close to our hearts and front and center. I'm delighted to see Mike Lynch here on the call, ready to bring all knowledge, all information and guidance to us all. So that's it. I'll be just listening and supporting. So thanks so much.
Well, we appreciate your support. Absolutely appreciate your being here. All right, Mike Lynch, welcome.
Thank you,
Definitely
Madam Chair.
appreciate you being here and appreciate all that you have done and all the knowledge that you bring. Evandro, did you have something? I'm sorry.
No, I didn't.
Oh, okay.
Go ahead. Sorry, I was clicking on my. Go ahead.
I know you've been involved with this issue and we're really interested in if you can, really the goal here today was to educate us as commissioners to what has happened and to what is really left to be done. And how can it get done? And what are the roadblocks and, as you see them going forward and the potential solutions. So I know this is something that has been top of mind for a lot of people, particularly since the schools have gone remote. And since it seems like we're going to be living like this for a long time, it becomes, I think, has become much more of a central issue to all of us. So looks like you're at home too, Mike.
That's correct. Yes, I am. Well, thank you for the opportunity. I'll be as quick as possible. I have spoken with you, Madam Chair, and Evandro, and participated in a couple of calls with Dr. Crockett on this issue. So you are all probably more knowledgeable than I am at this point in time. Would you like me to share the slide deck?
Sure.
Okay, I'll try to go through this very quickly. Thank you. Alrighty, I'll just do it this way. It's easier when we're remote. I'm working off of 2 screens here myself, but I think everybody recognizes this slide. It came out early in June or July, and it was the goal of how to get through this. And we try to take digital equity along these lines as well, hoping to get to a thriving solution. We're not there yet. We're really still in the Band-Aid phase of trying to address unmet need and unmet funding. When folks talk about digital equity and broadband, particularly in Boston, this is sort of the way we looked at it for the last few years. It is evolving now, but clearly the first thing was choice and competition. We do have choice and competition, so the majority of the public is satisfied with what is available to them through broadband. This is something that local government got stuck answering because the federal law and the rulings of the FCC have hurt us and undermined us and left us with vulnerabilities. So we have done other things like community connectivity. You have heard of some of the initiatives we've made at the Boston Public Library. I think a few of you know about Wicked Free Wi-Fi and other things. Some of these are matters of convenience or small solutions to discrete problems. The bigger issue that has obviously come into play this year has been the digital tools. And the digital tools are really the device, the way the thing you're holding in your hand or putting on your desk to get online, and the connectivity itself. That has been our massive problem this year. When we talk about Chromebooks, a lot of numbers fly around, but in reality, when this fiscal year is over, I suspect the city will have purchased over 70,000 Chromebooks at a cost of about $10 million, something that was not anticipated last February. So these are all dollars borrowed from someplace else. In addition to that, we have done things like hotspots and other types of connectivity, and that has run us to the tune of about, say, $3 million at this point in time, and that's just going to get us through January. Then we're back to the drawing board trying to figure out ways to pay for this solution. None of this stuff comes cheap, and none of it was really fully anticipated. The good thing is that everyone now, I think, is recognizing unmet need and seeks to address it in the city, and that's comforting. One of the challenges we have, I think it's a bit of a big challenge, is this last one, the digital skills. This is so hard, particularly in COVID times. I think most of you are probably familiar with a program called Tech Goes Home. It's a program that the city funds. We give them about $1 million a year, have done so for, say, the last 4 years. And they have an excellent network of probably 60 community-based organizations and schools. And they identify need in those schools kind of organically through the organizations themselves. And they provide, in addition to the tools, that device and hopefully connectivity, they also provide about 15 hours of training. And they do it in specific categories. If it's a student, it's how to learn online. That's today's big mission, right? If it's a new immigrant business, it might be some business tools online that they can use. They develop probably about 8 different platforms. All of these things were, of course, in-person workshops. So they have been transitioning over the last 5 months, 6 months to get as much as they can online and learning videos in order to connect people. There's one missing piece that's still a bit of a struggle for everybody. And that is for certain isolated populations. I'll use the example of seniors in, say, public housing who are isolated and alone or vulnerable. Getting them connected is a huge challenge. They have no experience. They have a little fear of technology. They're not going to let someone into their apartment. It's not a healthy solution to let someone into their home to get them connected. So the best that can be done is doing things by phone call. And of course, some of the equipment that is brought to them to help them get connected. Let's say it's a tablet or a hotspot. It's going to arrive in the mail and someone has to walk them through starting it up. To all of us, that may sound like simple stuff. It might sound like Christmas to have a package on your front doorstep. I think if you're a senior and you're overwhelmed by technology, it's frightening. And that is a challenge that we still, it's a work in progress. I guess I'll just put it that way. Sorry, I'm jumping around. This is, actually, I think Dr. Crockett and I share the same slide. There's a National Digital Inclusion Association, and they use 2 different definitions, one for equity and one for inclusion. The conclusion adds that extra component of training. And as I've stressed, that is a big challenge for us today. So what's next here in Boston? As I said, we've got a lot of competition in the broadband market. It works well for the city. These guys have been great. If I'm talking to them, I tell them they're doing a terrible job. But I can tell you, actually, they have been quite responsive, and we're very appreciative of the work they have done. Here are some of the packages that are available. Comcast, we can get into this, probably at the end, we'll get into this with a little more detail, but Comcast in Boston, actually nationally, has a program called Internet Essentials, which is something of a lifesaver. It is 25 megabit down broadband for $10 a month or $120 a year. It is very affordable. It is land-based, so it's facilities-based. It's a hard line, so it works. And they've actually been tooling around with this program for 10 years. They were incredibly difficult early on, but I think we've worn them down over the years, and they've made it a little easier. But there are still challenges. They make people go through a financial litmus test. They get all upset if you have an outstanding balance with them, all this stuff. But we're moving our way through that, and I'll explain it a bit later on. Fios uses, Verizon doesn't actually offer an affordable, but they actually gave the city some money for digital equity, and that's how they addressed it. They chose to write a check as opposed to develop a program. RCN is a much smaller organization, as is Verizon actually in Boston when it comes to broadband. And RCN simply matched what Comcast was doing as a sort of competitor to them, if you will. So this is just, I think most everybody here is familiar with some of these programs that we have in the city. I just wanted to touch on them briefly in the slide here and remind people that while we're working on digital equity for seniors, students, new immigrants, and other sort of vulnerable populations, I guess you'd say, we're also struggling with our own workforce who for a lot, coming up to speed with some skills or some technology and devices has been very challenging over the last 6 months. So we have done a lot to develop that remote workforce for folks, and hopefully it's all working, but it's taken quite a bit of energy from the IT department. I feel since I'm in that department, it's my job to really give them their due. So this is just briefly touching on some of the stuff that was early in the game. And some of this information comes from different sources, but you get the general idea. We probably are looking at a number around 5,000 that need something special. Some of these students and their family may not be in stable housing. So the wireless solution, the hotspot or a tablet or something is a better solution. It's not a panacea, but at least it can follow around them. They can stick it in their backpack and they have it every day. This is just to briefly touch on some of the studies that have been done. To the best of my knowledge, I think 3 studies have been done. The Elderly, the Age Strong Commission has worked through their providers to identify need. And, frankly, some of these agencies have been extraordinarily helpful because they're hands-on. And then the anecdote I'll use with you is that both the elderly and in the Office of New Immigrants, they have a strong connection with agencies that are providing ESOL services. Again, something that was done in person and is now being done remotely. We threw stuff, probably not even thinking about it, we threw stuff to them last spring as they demanded, can we have a dozen tablets here or a dozen hotspots there? But now we're learning that they need to continue to assist people who just can't, they may not be in their homes, but they need some training, some assimilation in language, and they can't, it has to be remote. And we're finding that the wireless solution is best for them. Having something like a connection in your home may not be a good solution. It's certainly not a good solution if you're trying to make an ESOL class between jobs and you're 5 miles from home at the time it's happening. So these are some of the things we're trying to keep in mind as we look at finding solutions that will get us through and beyond January. Again, I will leave these slides to you. I just wanted you to give you a little feel of some of the things that we're talking about, some of the activities that are being impacted by the lack of access for some. The public schools, I think we read all about it in the newspaper, so we know what's been going on there. This was actually an earlier slide from about a month ago, but they did survey their students. The way we find out about need from the school department is, again, somewhat organic, and it seems to work okay. But generally speaking, it's the teacher who identifies the need of the student and bubbles it up through the system. And now, just in the last week or two, the city has signed 2 contracts, one with Tech Goes Home and another one with the school department and Comcast for this program of Internet Essentials. Internet Essentials, what the city's now doing is this, it's kind of like the city gets a voucher book. I don't know. I'm old enough to remember that sometimes if you worked late at night, you'd get a voucher to go take a cab home. It's the same concept here, except we're going to give you a voucher and it's going to give you Internet Essentials at home for a year, and Comcast will mail you the modem and the school department will mail you the Chromebook. That's how it's supposed to work. It's just starting literally this week, and they're optimistic. I think we're anticipating we'll probably get 3,500. That's our ceiling right now for families that we think we will connect for 1 year. Hopefully that gets us through where we need. I think what's going to happen is after we do this for this 1 year, if you will, I think we're going to have to start doing it going forward. You know what I mean? You can suggest that people are going to have to take care of this themselves, but after a year of, after say this academic year or 4 terms of remote learning, I think it's going to become a natural assumption that the city will deliver this as part of this service of education. I don't know for certain, but I don't know, experience tells me that's where we'll end up. Again, a little bit more on the BHA doing a similar study. This just touched on briefly. I forget exactly which group did this study. Dr. Crockett might remember. And I think it was Age Strong. I'm not completely, but this was just their takeaway from some of the challenges of digital inequities. And this, as Evandro said, the city council is all over it. We had actually, I think Evandro, was a somewhat constructive conversation with the city councilors on this topic. Everyone is looking to help. I don't think we know all the answers yet. I think we have the short-term solution done. I think we'll get through this calendar year. What happens in January as we need to do things and continue into the year 2021, we're not sure where we're going to go there. So I mentioned earlier some of the steps it is that Comcast requires for Internet Essentials. As you can see, there's like 9 or 10 steps. They make it extraordinarily complicated. Now that the city is able to do this in bulk, we've also got someone in the school department actually handing out these vouchers. So I think we're well motivated. I think things will improve. We'll find out probably within the next few weeks, the next month or so. I've shared this, you'll get this if, I think I emailed it earlier to Susan, I'm not sure, but just some sample of articles and discussion from other communities on what they're doing to handle digital equity. I wanted to include it in there. I've been keeping this slide around for a few reasons. I don't know if any of you know Tom Wheeler, kind of an impressive guy. He was a good, smart FCC chair. And he went out and said, the internet is no longer nice to have, it is critical. Well, that's nice to say, but you know, he was FCC chair, and broadband is an unregulated service. There is absolutely nothing we can do to force broadband, and it is not a utility, and it is not a common good. So we have big challenges in terms of doing this. And that's why in this year, we find ourselves spending about $4 million filling gaps to provide service in homes, because this federal solution never really was successful. Sorry, I get a little preachy on that one. I apologize. Now, this last slide, I just put this in because I realized when I was coming to this meeting today that we had another meeting at the same time in the city, and that is the Disability Commission. And many of the commissions in the city televise themselves on our city channel, and we also put it online and we host it on the city website. I just put this in here as a gentle reminder to invite your commission that if you want for posterity or for public consumption to be televised and to be online, either live or as a follow-up the following day, we're happy to work with you. That's it from me, Madam Chair.
Great, very, very helpful and a good reminder. You know, right now, the last thing you said, Mike, in terms of recording, making it available on TV, and also disability services in terms of making it available to people with disabilities. We ought to keep in mind as we grow a larger audience, for sure. So let's open to questions for the commissioners. Why don't we start?
Good, no questions. Oh, no, I'm only kidding.
Could you go back to, could you go
Yes.
back to slide 18? One forward, sorry.
Thank you. Yes.
I'm sorry, this one went so fast. I just wanted to, I saw a
Oh.
3-pronged approach and I was like, oh, something moving forward, and I didn't get to read it.
So the 3-pronged approach is usually considered to be the device, the connection, and the training. I'm sorry, I
Okay.
should have been clearer. After I'm finished here today, I'll clean up this slide and make that a little clearer.
No, it is clear. It's just that it was only up long enough for me to read the first half of number one. So
So
of
it's a good
these,
thing. Go ahead.
So of these barriers, I mean, obviously you need to, as long as there's still any barrier remaining, the individual does not get online. But not everybody faces all three.
That's correct.
Which is the one where you would get, really kind of the most bang for the buck?
Good question. Good question and good way to look at it. The easiest thing to do is what we are doing with Internet Essentials. At this point, it is speculative, but let's say there are 5,000 students. We don't know exactly how many families, assuming more than one in some cases, that need connectivity. We're hoping, sort of, that 75 to 80% of them can be solved or resolved by an Internet Essentials connection in their home and the Chromebook from the school department, and that gets it. For others, the issue, as I understand it from the school department, is it's not so much instability, it's instability of the housing. You don't know, in many cases, the circumstances may be that, say, foster family, you may be in Boston this month, but next month you might be in Framingham. And you're still coming to Boston. You're technically still part of the Boston system.
Yeah.
So in your case, the hotspot is going to work best. And I don't know if that's probably the most illustrative example I can give right now.
And the primary group of people who really need the training tend to be older adults?
I think probably the isolated seniors are probably going to be the most challenging. Even the BHA is kind of tiptoeing into this because it's a little overwhelming. You don't want to freak people out either.
Yeah.
Yeah.
This is Leslie Harris. I have a question. I've noticed that a lot of people no longer have landlines. How
Yes.
do we approach them?
So let's see, good question. Generally speaking, we're going through the provider. We're waiting for the provider to tell us who needs assistance. So the school department, as the provider, will tell us what child needs better connections. We're hoping that the same will be true of, say, the BHA for families or immigrants or seniors in their housing, or Age Strong as they learn from their network of social service agencies for seniors, and the Mayor's Office of Immigrant Advancement for organizations that are, say, providing ESOL training and need to do a better job of remotely connecting with their clients. I hope that answers your question.
So can I follow up with that? When you say secure, low-cost landline internet, you're not talking about dial-up.
No, when I'm talking, I think what Mr. Harris was saying was, if you don't have a contact from them, say via a landline in their home, home phone number, it's a cell phone number. We don't have the white pages to find them. We're relying on the agency that they work with within the city to make that connection for us.
But your line says secure, low-cost landline internet access.
Oh, I'm sorry, on this slide, yes, low cost, that would be Internet Essentials
But
from Comcast.
I'm trying to understand what's landline got to do with that? Is that because
So
it's a fiber optics, because it's a,
it's either fiber or it's coax to your home or your apartment.
okay, so there is some,
That's
it's not a
correct.
landline, it's not a dial-up, it's just.
No,
the-
there's a physical facility connected to your residence.
Right,
That's what that would be.
okay. I was thinking, my goodness, I'm not talking about dial-up,
No, unfortunately, thankfully, we're not going backwards at this point, right? Yeah.
right?
Commissioner, if I can just add briefly, actually probably already seen this, Emily Shea, for those who do not know, is the Age Strong Commissioner for the city of Boston. She posted a comment on here, so she's helped Peter to sort of help us discuss, particularly as it relates to the aging population, which you heard plenty of time from Mike, that's one of the vulnerable population, with particularly related to isolation, social isolation. So I wanted to just kind of make sure that people are aware. who Emily Shea is.
Right, I did read it. I have a concrete question for Mr. Lynch.
Yes.
Is he still there? Okay.
Yep.
So what do you think the Human Rights Commission could do about this? How can we help?
I think at this point, I think identifying need is one thing, understanding how much need we have. The rationale that we give today connecting, and I'm glad Emily Shea is on the call because she's one of the people who's developing that rationale. Think of the city as a provider of services, right? We're providing some outreach to different communities, the immigrant community, Age Strong is providing to the elder community, schools are providing education. We're connecting people who are now isolated with those services. The second thing I think probably just need to be aware of is as the pandemic and the social distancing and the remote access dwindles, hopefully in the new year, I think the expectation of these services will continue. All of the money that we spent this year on this was found money. We were taking money from other programs and redirecting it to that to address digital equity or inclusion. I don't know what will be around next year. The city still has a few dollars left in digital equity money, and we're trying to determine how best to spend that now. But it is a bit, I don't know, maybe I'm just, long time ago, I just figured it's all about the money when it comes to this stuff. And I don't know what next year's money, I don't know what the source of revenue will be next year. Many of the dollars that were spent this year would be, say, CARES related money. That's not going to be available next year, to the best of our knowledge, even if things change next week. Can I say that during a commission hearing? I think I can.
But there are other funds, Mike, right?
There are the funds to get us through this year. The year following, the fiscal year beginning in July, I'd say would be a question mark. We don't know what July brings yet.
Right, but I'm talking about philanthropic funds that have been raised from two different funds that have been raised that could be tapped for this kind of thing.
Yes, the Resiliency Fund has given
Resiliency
some
Fund.
money to, say, Tech Goes Home. They've probably
Right.
given some money to others. They're aware of the need. We are working with them. And the city has an identified fund of probably $1 million that we have yet to spend
Right.
that we need to determine what we'll do. But $1 million, at this point, I don't know how far $1 million goes.
Not very far.
Yeah.
So I
Sounds
want
very glib. I'm sorry.
Yeah, no, I know, it's not very far. So I know in the school department, parents are people who have been saying, we need help. The children are learning remotely, but they don't know how to help their children. So they need technical assistance and support, like from somebody like Tech Goes Home.
Mhm.
I'm also wondering how many households in Boston do not have access to internet today?
I think, this is a wild guess, but I think it's between 5 and 10%. And our logic, Mark Racine is over at the school department. He sort of shares that thought. You figure about 300,000 households, that would be maybe 15,000 households without access. Prior to this pandemic, people who didn't have access at home had access at work. For instance, I was talking earlier briefly about city employees having trouble with technology at home. I could not believe how many city employees didn't have home internet access, but they didn't need it. They had it in the office. They could go in the morning and get their work-related stuff. If they needed to, I don't know, do something online, they could do that during their lunch hour or after work or whatever it was. So they didn't need access at home. It's only really this current year that I think has made a pressing need that people need their own personal access.
So this is about to get a little more complicated as we run into the eviction epidemic.
Mhm.
And people lose their housing and therefore connection to the internet.
Yes, I think it will be. I think if you think of people who work in service industries, generally speaking, I'm making some broad assumptions here, but I'm trying to understand things. You might be working more than one part-time job to make it all come together. So you're not home all day long. Your internet access is usually in your back pocket. It's maybe a smartphone or something along those lines. So for you, that internet essentials or that land-based or line-based connection at home isn't going to do anything. You need it to be wireless, portable, and in your back pocket, because you're out on the road 12 to 14 hours. All you're going to do at home is sleep.
So the difference between, though, a student trying to learn
Yes,
and your cell phone is quite dramatic. I mean, you cannot do your
absolutely.
schoolwork on a cell phone, though some of them are
That's
trying.
correct. I don't know how many you have tried it, but try opening up an Excel spreadsheet on your phone and see how far you get.
Right. It's just impossible. It's incredibly challenging. I'm
That's
gonna
correct.
that's really my concern at the moment. I mean, I think there are issues around remote learning for kids. I think there are issues around recovery, which I've heard the mayor talk about, people in recovery who
Yes.
can't now go to meetings.
Mhm.
And this, I guess there's been some quite important access that people are taking advantage of the internet
Yeah.
to attend recovery meetings.
Mhm.
And also telemedicine has become quite important to people who haven't been able to access healthcare before. And I also think that telemedicine has created an opportunity for people to access big systems and find someone who speaks their own language, which creates a sense of trust that they haven't been able to have before. And not just in terms of healthcare, but in terms of healthcare information. So I think the hospitals have, have some, not only some of the small businesses
Mhm. Madam Chair, I think someone's stealing some of your broadband at the moment.
We can't hear.
We can't
Yeah.
hear you.
in 2020 not right. There should be a way that we can find a solution to this.
I don't.
I think we
that
missed some
everyone
of what
can hear.
we missed some of your comments, Madam Chair, because I think you lost some of your internet connection there. But one of the things you mentioned,
Are better at doing this than maybe the CEA, because they provide not only internet access, they provide, I think also in a variety of languages, the sort of technical assistance to get people online. I don't know, what do you think?
Mike, did you understand that?
no, I'm sorry, I did
Yeah.
not. But one of the things I can tell you is, so what's happening to your chairwoman right now is oftentimes what's happening in homes. Some of you are probably aware of it, and we're certainly seeing it in the school department. You put 2 or 3 people on distant learning at the same time, and we've got probably robust broadband at home, and it's a challenge. Internet Essentials is a great solution, but with only 25 megabit down and 3 megabit up, you put 2 kids on that connection, it starts to stress the system, and you're having disconnection and audio problems, much as we're seeing and hearing here.
Yeah, we have heard that there are disparities across the city in terms of the quality of internet access. And I don't mean like different packages, like Internet Essentials versus a normal residential package versus a commercial package. I'm talking about people who are paying for the same package and are experiencing different service levels. Is that something that you can confirm, deny? You've heard it too, haven't heard that, new to you? What do you say about that?
It's tricky. Usually I mean, I'm not going to refute it. People do complain about their connectivity, but usually there are other issues. Broadband, when it's delivered, particularly by a cable company, is delivered at a rate, and they'll throw a number at it. They'll say, oh, it's 100 megs or it's a half a gig. You're all set. You'll be doing great, you know? And it's up and down. It's only my wife and I in the house now, and I think my tenant might use it as well. But every once in a while, I'll go on the dashboard and look, and I'll see that there are somehow 30 devices connected. I have no idea what all this is. And I have to sort of go through and figure out who's stealing all our thunder, so to speak. Sometimes it's that issue. Sometimes, on the other hand, we have had frequently people who are actually using someone else's Wi-Fi and just as a convenience or whatever, you know what I mean? And think that belongs to them. One of the programs we mentioned was Wicked Free Wi-Fi. It's the city of Boston's free Wi-Fi. It's something of a public convenience. It's only available, say, around shopping areas or public parks. That's where around city buildings. That's where we can hang it for free because we have fiber in those buildings. And it's there for a little bit of a convenience, but it's not meant to replace home Wi-Fi access. However, people who live near these buildings, they can get it, and sometimes it works. So they assume it's always free and it's always there for them. Commissioner, I guess the one thing I could say is not everyone is actually buying Wi-Fi. I think it was a little bit of a surprise this year when people realized I have to pay for this because they get it as a convenience. They might get it at work, or they might get it, in a coffee shop, and it never really occurred to them that they need to buy it for their home. I don't know if that helps. It doesn't. The need-based thing is something else entirely, but people's understanding of how this gets provided and how you pay for it is a little complicated.
Yeah, so we would need to actually have somebody go out and measure it, like that data about on like a neighborhood level or a census block level.
Yeah.
That would not exist anywhere independently.
So if we think in Boston, if we think of Comcast in one manner or another, back to Cablevision, it has been around for 30 or 40 years. They have comprehensively built throughout the city. They are on every street, but they may not be connected to every building. If you're, now we go back to think of your parents, right? Somebody may have decided a long time ago, I don't need internet access. I don't need cable TV in my house. So the house never got wired. That in the middle of a pandemic, that house is not going to get wired quickly because the workers themselves are reluctant to go inside the home. So if you're not already wired, that's going to be a problem. Maybe you're relying on your phone. And if you're relying on your phone, that is a very fluid situation. You can do emails, you can check a few websites, but to do a video conference such as we are here off your phone is usually a challenge. I don't know if that helps.
Can you hear me now?
We can hear you now. I think that was an ad on TV at one point, wasn't it?
I couldn't hear you either. So there was somebody didn't like what I was saying, not want to hear me, nor could I hear you. So I don't know what happened.
When you were speaking, you brought up one constituency that I did not address, and you talked about people in recovery.
Right.
Early on, we went out to River Street, out to the old Mattapan Hospital site, and went to a couple of recovery programs and gave folks out there some tablets to use. And you're right, they absolutely need it. It was crucial to their recovery at this time. You're going to go to a daily meeting. There's only one way to do it now. And I did that in April, but I haven't been back since, and nobody has asked. I don't know, maybe we should go figure that one out a little bit. So,
well, that's why I'm saying that there's a lot of needs here, and I think there are a lot of different folks, whether it's hospitals or people interested in supporting people in recovery, people interested in making sure that households, particularly households with children, immigrant communities have access to internet. They can't just use, a cell phone, would be willing to put up some money to support this to organizations who are willing to do it. And I know Tech Goes Home is not the only one. It wouldn't solve all the problem, as you say, Mike, because it's money is not the only issue. But I also think there's got to be a way with Comcast if you are eligible for free lunch, that should be enough to show you're eligible for basics, right?
It should be. It is for the FCC in terms of E-rate for reimbursement for providing those services to the schools. So it should be, yeah, you're now being logical.
I'm sorry.
And this is,
I went to law school. It's a terrible burden to carry. Terrible burden to carry. Judge is, isn't it? Right? I mean, to be logical. I mean, it's a terrible burden. But maybe Chief Crockett could, get them to be logical there,
There you go.
and take some of that paperwork burden away, because, and one of the things that has happened in a lot of these situations with the feds is if you show that you can certify it for free or reduced lunch, everything else falls into place. I mean, if you can show you can get WIC, then you don't have to show other things. So maybe there's a way to do that. And if we could do that, and we could appeal to, the hospitals in town are interested in this. If we, you've got everybody to chip in a couple of $1 million, saying it's about recovery, it's about telemedicine, it's about the schools, it might make a difference. So, and you could help guide us as well, I mean, I don't know how many millions of dollars would make a difference, but
I don't know, if I know that Tech Goes Home as an organization, again, we probably were their sole funder for the last 4 years.
Right.
This year, I think we're giving them less than half. All of a sudden, people are throwing money at them. They're loving it. But they're also, it's going right back out the door as a Chromebook or service to people and stuff. So they're running a great program. If you like, at some point, I apologize for taking up a lot of your time this evening, but if you'd like to visit with them at some point and anecdotally understand this, be happy to have them join the discussion with you if that helps.
Right. I did talk to them at one point, and they are gearing up in terms of staffing. And I think they're prepared, at some point to meet some of this significant need with, I mean, it wouldn't happen tomorrow, with the right kind of financial support. And I think with your help and some financial support, they might be part of this answer. Maybe cut it in half at least, and that would be significant.
Well, they're a great organization. When you mention financial support to them, are always willing to help.
I used to be on that side of the business too, on the nonprofit side. I was always smiling when somebody said, we're willing to give you some money to do this. So, so Mike, you think that might be part of the answer? Yes?
Yes, ma'am. I think so, yeah.
And I think, as I said, I think the hospitals and people who support people in recovery and, people who are concerned with remote learning for these kids. I mean, who would not be concerned that there are some kids who are still trying to learn off their cell phones?
Mhm.
And I think children of families who don't speak English as a first language, to have somebody help them in the home, not in the home, but online, who is it who told me the other day that that there are opportunities in multiple languages in City Hall that you can get, but the advertisement to say that the opportunities
yeah.
there are only in English.
I think that's being discovered everywhere. It's the best of intentions. The accessibility is there, but the ability to communicate or marketing it, again, usually in city government, you're providing a service. You don't think you actually have to sell the service. Do some
Right.
outreach,
Right.
I wonder if AARP Massachusetts would be a good partner for seniors. And I know Emily, she knows Mike Festa,
Yeah.
Mhm.
the president. So I think we can probably tap Mike on this.
Yep. I think there are some answers here. I hope. But Mike, I appreciate, I want to make sure anyone else who has a question, and also Mike, if you have anything you think we should know, we have a couple of minutes here.
I had a quick question.
Yeah, Robert.
I just want to clarify, throughout the entire city, does every household, from your understanding, have equal access in terms of purchasing? And is there areas or purchasing access? And is there specific areas of the city that, because it's not regulated, the private companies have not put the physical infrastructure in evenly throughout the city? Or is it just the opposite, as it is evenly distributed?
Good question, Robert. Comcast is virtually 100% of the city. Verizon is now building as a cable company in the city and has been for the last 3 years. They've probably reached, you build a system, it's networked down until you get to the homes, and they've probably built out 1/3 of the city and aggressively pursuing the rest as a direct competitor to Comcast. Lastly, RCN, the other legacy company that was a competitor in Boston, has no more money. They probably reached about 25% of the city, and they will go no further. So in answer to your question, I believe that virtually the entire city has some access to cable or broadband. Our goal, or the goal of the administration in bringing Verizon in as a competitor, is that within the next couple of years with Verizon, big company, deep pockets, commitment to Boston, we will see true competition in every community. Hopefully that ends up with quote unquote better pricing and better service. That's always been the concept behind competition. I'm not sure it will, but it was the only option really afforded to us. I hope that answers your question.
What we've seen, and I think we saw a map that was laid out, was that, the fast internet, the fiber optic internet available to me in the Back Bay is not available in Mattapan. It's copper wiring. And so there is some difference in different parts of the city, what is available. And what's interesting here is that when the technology legislation was done in the federal government and deregulated, the idea was that competition would lower the price.
Yes, yeah,
And
I'm not
instead,
sure
the
I'm convinced, right?
The competition, we deregulated so that there are places in the city that don't have fiber optic fast internet, but the price did not lower. Deregulation did not lower prices. It just did not. We now no longer have the authority to force internet providers to provide for a whole city. So deregulation didn't work in this industry like it has in other industries. So
That's correct. Cable is Title VI, telephone is Title II, and broadband is something that we cannot touch or cannot influence. It's very unfortunate.
which is, except they do have to lay wire underground, and we own the ground.
Yes, that's
Public
correct.
Works. So we do have some control there in terms of licensing to go
Yes.
underground.
Yep.
So, yes,
And-
So I just want to
Yes.
keep in mind those 15,000 families that don't have access, and how do we get them access, especially since everything now is online. If you need help with your housing, we live in a world now we're not having internet access. It leaves you out so completely. So
Mhm.
how do we ensure that the 15,000, probably the people that need it most, can obtain that access that they now don't have?
I totally agree. It's 2020 and we have 100% remote learning in the Boston Public Schools. And we have a COVID epidemic. People need access to healthcare and to answers. And in Boston, we have, 10%, 15% of the population who don't have access to internet. What are we going to do about it? That's the question, right?
Well, I think, or I like to think that the solution for the schools has been made or is being made. That problem is being addressed. There are isolated situations where someone's Chromebook doesn't work or their hotspot doesn't work or something like that. But the solution for the schools the initial Band-Aid, get them something fast, which we did with wireless hotspots, and the long-term solution with get homes connected. Those are in play right now. Those are happening. We'll have to measure it and sort of reset in a couple of months. See how well the progress of Internet Essentials, buying a year's worth of service for a student's home, see how successful that program is. We probably won't know for a couple of months. Regarding other constituencies, seniors, public housing, vulnerable populations, folks in recovery, new immigrants, again, that's why they are, as you saw in the slide deck, surveying both their providers and their clients or residents to figure out what the need is. The fear is it's large. How we solve it, we just don't know. You know, the CARES Act money sounded great when it came in. Ton of money come in and we'll spend it. You had to spend every dollar by December. I don't know how many of you are in government, but trying to spend money that quick is an almost impossible task. Sorry, I'm getting a little preachy. I better get off.
No, that's it. I was in the government. I understand. I actually think it's hard to spend that money, but if you give it to a nonprofit, maybe they can figure out how to spend it. Nonprofit's pretty good at spending that money. So Michael, I really appreciate your joining us. I think we, working with Chief Crockett here, would like to find a solution. We'd like to be part of it. I know she's taken this and she's still on very seriously. And I think we, representing many different constituencies here, housing and schools and many other areas of the city, would really like to, as I know you would, really like to find a solution, because it hospitals, healthcare, and I think people would chip in and find ways to help if they were asked. I really do think so. If they knew there was a solution, you know. And I do think the hotspots are, you know, are short term. You're right. I mean, they are short term. They're not going to, you know, in January. I think we'll probably be in the same situation we are, but we need a longer solution here. Anyway, I appreciate it, Mike. I'm sure we will talk again. Whether you like it or not, we probably will talk again.
Very good. I'll stay in touch with Susan, and I know Evandro and Dr. Crockett have been in touch, and hopefully we'll continue to. Hopefully we'll have some positive updates soon.
Yeah, thanks
Thank
a
you,
lot.
Mike.
Really
Thank you.
appreciate it.
Bye now.
Okay, bye-bye. Okay, so the next thing on our computer, on our agenda, I'm getting into technology here, is we want to talk about International Human Rights Day, which is December 10th. But we also want to, before I do that, I want to follow up on this too, is next steps on this. You know, we talked about doing, and Ben, I think you were the one that suggested it too, is doing a hearing on this issue. And I don't know whether Chief Crockett is still with us, but and having more people come in and talk about this, because there are people who are saying, I don't have connectivity. I don't have access to the internet, you know, how do I get it? What do I do? Where do I go? My kid can't get online. He's already lost 8 months of schooling. What do I do? And you know, should we have hearings? What do you think the next step on this is? I mean, I hate to hear this and then just go away. And
I
go
think
ahead,
we
Rick.
need a bold idea, or a couple of bold ideas. And if the 2 or 3 companies that are controlling the market right now do not come out with an idea of their own, then perhaps we can seek another possibility, another company that might do things different.
I think,
Good.
historically, for many years, it was just Comcast, now Xfinity, and that sort of explains why Mike was saying that they're everywhere.
Right.
And RCN had like this little toehold, and I think what he said was they're out of money, so they're not
And
expanding.
gain it.
Yeah, and Verizon is the new thing. I would love, Evandro, if you can follow up with Mike. I wonder if he has a map that answers Rob's question as to Verizon, like if they covered a third of the city, which third did they choose up front?
Right.
And you know, where are they going next? Because I mean, it does sound like they're coming in, but I mean, just to have a second one to compete against Comcast is, I think, a huge win
You
for
know,
the city of Boston.
Interestingly enough, I had a young lady working for Verizon knocking on my door earlier, right before the meeting, to try to do exactly this. And so maybe I'll perhaps.
They're all over Dorchester right now.
Right.
They're
They
into
have been.
Dorchester right now.
And probably
Sorry,
experienced this
Steve,
last year when they came to JP. They like, when they're there, they really want to do the work like right now, because we're here.
Right.
And there's like a swarm of trucks and then they're gone.
No,
I live in Roxbury, and I've had it a little over a year now. And I'm very satisfied with it.
You
what,
have,
what do you have, Verizon?
Verizon, BIOS,
Oh.
Verizon, yes.
right,
Okay.
I had
Yeah.
Comcast,
you've had it
And-
for a year,
well, over a year now,
over a
but
year.
I had Comcast before,
You did.
and I had automatic payments. They changed something, and I was like $3 short because it was automatic. I never looked at it, and they turned me off.
Oh, my God.
I got so mad, I took it, said, here's your $3, here's your equipment. And fortunately, somebody else came along.
Wow.
Maybe
No,
we
I-
ought to talk to FiOS.
All right, well,
Let me add something
Yeah.
quickly if I can. I think what I gather from him, I think that there might be space, particularly through hearings, to do is this identifying the need, right? I think he said to identify the need. It sounds like the BPS, the needs sort of been identified. And he mentioned some surveys, including one that A Strong has done, to sort of identify the need within these populations that are particularly, potentially being part of this 15,000 people. And he mentioned, new immigrants, the Asian population, the folks that, obviously students, what we talked about. Like, how do we get to an extent, gather the information on this need and give a voice to this need in a way that something as simple as having some folks within this population come in and testify to what that, given a human sort of feel for the issue, to the narrative. I think that's one angle that I see based on what he was saying. He said, one, identifying the need going long term, right? Because apparently we got it figured out more or less going into the end of fiscal year, but beyond that, the money will dry, right? As he said, essentially, where is the money coming for next time? And in the second part of the hearing, if you will, it's kind of focused where this funding can come. And that's where, to some extent, some of the folks, some of the players in the private sector, both, Comcast, obviously a big deal, and even RCN, I know they ran out of money, but like, these are, bring them to the fold that way, right? Listen, we this is the data that we gathered. These are the folks that are hurting, and where can we come up with the gaps, right? At least that's what I got from sort of listening to them and where the gaps are, right? If we want to focus, right, and get something specific deliverables, I would think giving a voice to them, and two, coming with the remedy, the funding. It sounds like at the end of the day, it was about money, right? Figuring out how do we increase this funding to do it long term, I think it could be helpful. At the same time, learning more about the different areas that have what and why do they have those areas. I think that's how at least I got from his discussion. I think it's very helpful.
so maybe what we could do is follow up, at least at the next meeting, is invite some of these folks or entities who are, who don't have access, a parent group from BPS, somebody from the recovery community, healthcare,
Right.
e-commerce, maybe just a couple of people to say, this is a real problem and this is why, and this is what I've tried and it hasn't worked. Housing, senior housing, maybe seniors, to help us better understand what we're facing. But in the meantime,
Mhm.
It seems to me these folks have been working on this for a decade. There ought to be a solution. We're trying to figure out a solution, and there's experts in this around.
Mhm.
I'll talk to the Tech Goes Home people. I did talk to them, and they said basically, I think it was for something like $6 million, they could practically close the gap.
Yeah, this is an opportunity. This is an opportunity for somebody. Somebody is out there that could take advantage of this huge gap or big gap
Yeah,
and provide services that are affordable, and enter a market that
yeah.
that needs it.
Yeah, I just, you need a broadband czar here. An aggressive, innovative broadband czar. I like those jobs. Like king for the day, a queen for the day, or a czar. I love being a czar, But that's what this needs. That's what this needs, is somebody who understands all the issues and comes forward with an aggressive plan and raises the money and gets Comcast and Verizon to the table and gets, whether it's the hospitals and others who are willing to come by with some funds and, anyway, okay, I'm done my lecture here. So, okay, so why don't we try to bring in some folks who can
Okay.
further, besides me talking about it, others who are have a read on how much of an issue this is. We already know it's quite an issue. Let's talk about the December 10th. We want to do something December 10th. It is International Human Rights Day. And I know Judge Harris talked about our interest in Black men and boys, young men and boys. And the question is, what do we want to do with that day? I had suggested to Evandro that maybe that we have a speaker like, what's his name? From BU.
Ibram Kendi.
Ibram Kendi, and then have that followed up by a group of folks locally who are experts in the area, that it be sort of two things, that it not be just one, that there be a conversation with him, but then a conversation that somebody interview him, and then a conversation with folks, local folks dealing with the area locally. That there may be two events in the day, or something like that. So I'd like to hear people's ideas about what you think we should be doing. The reason I thought about him is because he's such an attraction. I was trying to get people to come, but also I want folks locally to understand what's happening here with this issue in Boston, not just, it's an issue everywhere, but here, and how much of a problem it is in Boston and what people are struggling with and doing here. But I'm not the expert here. So
Leonard Lee.
What do you think this should look like?
Leonard Lee is the person who pushes this a lot, because this is what he's worked in. He's talked about trauma, not just young Black men, but Black men in general.
Right.
The trauma that they live with every day. I think it's a worthwhile discussion. I think it would be a wonderful thing as a kickoff. that we could have this as the initial hearing, but do other projects, quarterly or something, where we address, say, folks who are not Black men, but also suffer from trauma. I mean, something different. We could spend the whole year dealing with the trauma of Black men.
Sure,
I know William James College has been addressing it.
right.
Harold Cox over at BU School of Public Health. There's so many folks we could draw on, including Leonard.
And Hardin Coleman. Hardin
Yep.
Coleman. Yeah,
Yeah, Coleman, I think is the name.
yeah. A
But
lot
there,
of folk is in this area too.
we could get a number of folks, but we need to do it right away if we're going to do it.
Well, I agreed. The reason I had thought of Kendi is because he's a name. I was trying to attract people to
Yes.
come, and everybody wants to hear him. But that was the only reason, is that I was trying to raise our visibility and at the same time have people locally talk about what was going on here. But I'm not wedded to that idea. I mean,
If we're going to do it on December 10th, we need to get somebody who will be a draw.
well, that's what I'm saying. We need to get somebody who will be a draw. And the other thing about being virtual is that, you can tape things ahead of time.
Yes. They don't have to be there.
They don't have to be there these days, because you don't know whether, you can tape an interview ahead of time, and you can have a panel follow it live, or, so what do you think it should look like? Or what do you think? I don't know whether we can get him anyway. I have no idea,
Well, maybe we could have him give a tape, like you said,
Yeah,
about the issue,
right.
and then have someone like a Harold Cox or someone moderate a panel
Yeah,
on the issue with local professionals.
does that work? Does that make
Sounds
sense?
great.
If we can get him, I don't know whether we can, but
If not him, then we get someone else, But that's why we need to find out right away.
all right. Well, we had a letter, we have a letter ready to go, but I wanted to wait until tonight to hear whether or not people thought that was a good idea. And I don't know whether he can do it anyway. So,
I
I think it's a good
Leonard
idea.
was trying to find out if he was going to be able to join the meeting,
oh,
because this is his life, so.
Judge, I'll piggyback on that because I had conversations with him, with Commissioner Lee on this, and he was excited about the opportunity to potentially do an event. What he focused on, at least with me, was that he wanted to see this event, if it's going to happen, to be part of a bigger strategy that we're thinking about, as you kind of alluded to, in terms of addressing this issue in a way, right? That he didn't want it to be a one and done.
done,
To
yeah.
an extent, which I hear him. I think it's just like the digital divide. It's not an issue that you can kind of just go in and leave, right? I think partly what we're experiencing as a commission is that if we're going to take on certain issues, and we have a list of them, that we take time to each and sort of give its course, try to come up with meaningful conversation and meaningful solutions that we all can be proud of. I think that's partly what's there, because he obviously cares very much about the issue, and has been pushing it. So that's
Would it make sense to have a Black Lives Matter series?
yeah. I mean, that could be one thing. That could be right. That could be part of a bigger picture as well. I mean, I guess this discussion kind of leads me to sort of something that, in fact, I discussed it with Susan briefly earlier, is that perhaps in between the meetings, we can find a way to sort of have a smaller group discussion on some of these things, so that particularly if we're moving them together, that, they don't get dry, then we get a bigger meeting going. We don't get to discuss obviously everything, so how do we keep the discussions that we, particularly as we develop how do we keep these things more live for each of you, particularly as, you know, hopefully the meetings will be monthly or so. How do we keep it going is one of the questions that I'm debating, and I think there might be a chance to kind of break out into sessions, if you will, or you know, subcommittees, whatever makes sense for all of us. But that's something that's been on the back of my mind, so I figured I'd raise it now.
So it's a small group. I wonder about subcommittees, but
Small
actually I
group,
wonder
yeah.
about things that are more public.
I'm sorry, repeat that.
Things that are more public, like, you know, like what we're talking about on December 10th, that at least quarterly we do things like that.
Right, right.
You know, that bring in a much bigger audience to discuss these kinds of issues and raise these kinds of issues. I mean, one of the things I think about trauma in Black boys and men is like police in the schools is one of the things that comes to mind. But the school to jail pipeline, you know, is another one to talk about. But there could be a series of things we do that are public discussions.
Right.
You know, and this would be the first one. So we could think about topics that we wanted to bring people in to talk about and that would be open to the public. I don't know.
Okay.
You know. So we'll go ahead, we'll ask him if he can do it. I don't know whether he can. And then we'll rely on you, Judge Harris, to help us find the right local people, okay? And we'll move ahead, see if we can make this happen.
Okay.
And I don't know what time of day, I suppose the end of the day, but you know, the days don't make any difference anymore. I mean, what time of day? I don't know. I don't even understand, you know, noontime, 5 o'clock, I don't know.
If he's unavailable, I'd encourage you to consider another academic, because, you know, he's not just a name, he's got that whole infrastructure of BU.
Yeah.
And the ability to publicize it, existing mailing lists, all of that, that I think exists, even with people with less big a name, but affiliated with a similarly impressive institution.
Yeah. And also, if you have this sort of academic who brings the sort of research, bigger picture, and then you have local people talk about the reality of Boston, and I think is a nice sort of combination. I agree. Let's try to figure that out.
Okay.
See if we can do both. Okay, other things that people want to, commissioners want to bring up before we go to public comment? Anything else? Okay, so members of the public will now have an opportunity to ask a question, provide public comment. To do so, please raise your hand or type your question in the chat in the application for your Zoom meeting platform. If you are calling in and cannot use the platform, you can press *9 to raise your hand, or you can send your question to staff via email at susanhemley@boston.gov. Okay. So.
Okay, we do have one comment in the chat box. I don't know if everyone saw it.
Yes.
Also, we have one more hand raised. 1 second. I would like to note that you have 2 minutes. So I'm going to start the timer whenever you're ready.
Thank you. My name is Rowan, and I wanted to ask a question and reach out for assistance. I'm a non-binary transgender person. I'd rather say not which neighborhood I precisely live in. And the continued discrimination in accessing critical health and human services is such an incredible problem. Particularly today, I'd like to bring up the issue of transgender people in Boston being discriminated against in accessing COVID-19 testing. In September, I was asked by my physician to get COVID-19 testing because of symptoms I was having. And had requested the testing site I was getting tested at, which tests one patient at a time in front of many other waiting patients, simply to politely refer to me with my preferred pronouns. As I think anyone here could understand, after giving the name they had in their system and confirming my date of birth like anyone else, and the test tube sticker was correct, saying she or he or they has nothing to do with identity. They don't ask you what's your pronouns after what's your date of birth at the doctor's office to identify you. And there's no reason we can't say use someone's preferred honorific, even if you don't want to respectfully use their first name.
You have 30 seconds.
So I've called many offices, the mayor's office, the Department of Public Health. I've called everywhere I can think of. It's been 6 weeks and I still can't get tested. It's been so long, those symptoms resolved, and I have symptoms again. The transgender community is afraid to get tested because that escalated into the police being called, saying it was disruptive for me to simply ask to be referred to respectfully. And I would be immensely grateful for any guidance that can be given or help with this issue. The Commission Against Discrimination's investigations take often 1.5 to 2 years, which is too long to wait for COVID-19 testing. Thank you.
Could I ask you to send to Susan privately where this occurred, because this makes no sense to be, I don't know, I don't understand it, but there's lots of places to get tested in the city, and particularly now that the mayor is suggesting everyone get tested. So why don't you send to us where this was an issue, and why don't we figure out where you could go and be treated in a dignified manner? Was that helpful?
I appreciate that. I will take you up on that offer. Thank you. I would hope that our testing centers could perhaps be trained to not discriminate against our community members instead of telling people to go somewhere else because they're a part of an oppressed group.
Yeah.
But thank you.
But absolutely, that's why, if you don't mind, I'd like to know where you went. And also, let's see if we can help you find a place to go.
Yes, I think that information, Rowan, that information will help us. It will help the commission move. I don't know, Susan, do you know how to do waiting rooms? You can put.
She could, I think, Reyes, she could just email Susan.
Okay.
Yeah, Rowan, if you want to email me, it's just my first name and my last name, just as you see it. So it's susan.helmy@boston.gov. If you want to email me or send me a message privately.
Yeah, not in the chat, just privately.
Yeah.
Okay. All right.
Mm-hmm.
All right. Any other questions or comments?
We do have one comment in the chat. So Elena asked, during the last meeting, it was mentioned that there were going to be a number of jobs posted soon. And they were going to be posted ASAP. I haven't seen anything. When should we expect to see job postings?
It's going to be a while yet. You have to go through the budget process, right, Evandro?
Yes, we are, we're making leeway. So I apologize to you, Elena, because I remember you asked the same question last time, but we are making progress, but we're going through the channels within the city to post those positions.
It's the government. They will be posted. Other questions?
Susan, I just spelled your email. Is that?
Yep. Thank you both. And to Ben, thank you guys.
Okay.
Leonard Lee, Commissioner Lee, I think I fixed your problem, so you should be able to speak or turn on your video.
Yeah. Okay. Anything else?
Let's
Oh,
let's see if
connecting to
Lee is
audio.
able to connect. That's the Commissioner Lee, who apparently had some connecting issues. He typed a message.
Right. Well, he was in good company. I had problems with. The
There you go.
troublemakers get shut down. That's what happened. All right. Can I have a good meeting? Can I have appreciate everybody participation and we will see you next time. Can I have a motion to adjourn?
So
Motion
move.
Second.
Second.
All those in favor?
Aye.
Aye.
Now you're taking up the whole screen.
Are you there? Maybe perhaps we should let him say something. I don't know, sure if you
Yeah.
can hear us or not.
This is
Yeah.
crazy. This is crazy. I felt like jumping out the window.
What happened? You couldn't connect?
I listened to everything that was going on and I couldn't connect.
Oh, wow.
Wow.
So, yeah.
Well, if you want to chat with me or Evandro, I'm glad to, maybe Evandro, you could follow up with Commissioner Lee and get his comments and then we could share them with others, okay?
That sounds good because I heard everything what was going
Okay.
on. So,
All right.
Okay,
All right. I'll circle
All right.
back with you then.
all
all
right.
right.
I apologize for the inconvenience.
No
Commissioner.
worries. No
Yeah.
worries. I mean,
All right.
I'm this tech thing. I'm trying to learn as much as I can about it, you know?
Okay. All right. Have a good one, everyone.
All right, y'all.
Thank you,
Thank you.
everyone. Have a good night.
Be safe, everybody. Thank you.